In Jerusalem, thousands of ultra-Orthodox Israelis defied the country's ban on large public gatherings yesterday. It happened at a funeral for two prominent rabbis. Many of those in attendance did not wear masks. This comes as Israel attempts to gain control of the outbreak through an aggressive vaccination campaign across the region. Isabel Kershner is following the country's latest efforts to immunize its population. She's a correspondent in Jerusalem for the New York Times. Isabel, great to see you. Love your work. So you took a look at some promising preliminary data on coronavirus vaccinations released by the country's government and an Israeli health maintenance organization. Walk us through what these results show. How encouraging is the data for the rest of the world to see?
Okay, good morning. Thank you for having me. Well, the first thing I must say is that a lot of this preliminary data is based on the 60-plus age group, who are the first to have been called to get vaccinated. We're now up to 82%, I believe, of the 60-plus age group that have received the first of the Pfizer vaccine, and about 45% have already received, or a week after receiving the second dose, which is defined here in Israel as fully vaccinated. So the initial studies have been very encouraging. They've shown, the health ministry put out some data a few days ago of 0.01 or 2% of people who had been fully vaccinated having contracted the virus, and a similar result from one of the main health funds here. So very encouraging, but it has to be said with many caveats that this is very preliminary data. And one of the big questions, of course, for people out there is, well, as well as decreasing hospitalizations and cutting down the actual number of confirmed cases, to what degree are these vaccines effective in preventing transmission? And although there does seem to be some very initial evidence that there's been some decrease there as well, we're still very much in the fog of war on that point, because Israel is, as you pointed out, we're in a kind of race between the effects of the vaccine program, which is going extremely well and rapidly, but also a race between the virus, which is still rampaging here. And we are in a big third wave of infections and under a third lockdown.
Isabel, you may have actually already answered my question, but I just want to make sure there isn't any other information. You mentioned these are preliminary, that there are, at least that we need to acknowledge that it's just the 65 and over crowd. Are there any other variables that may be skewing this, and any other sort of data that should be considered that isn't available right now?
Well, absolutely. I'm glad you pointed that out, because the caveats include the fact that the first people that rush to get vaccinated by nature are probably more conscious and aware and careful in any case, probably practice more social distancing and mask wearing. And at the same time, there have been differences in locations where there's been more vaccinations and less in some of the sectors of society, including the ultra-Orthodox sector and the Arab population. The numbers of people coming to get vaccinated have been a bit lower. And of course, there are socioeconomic differences. Many of these initial studies were not done with rigorous statistical analysis against control groups. So it's very preliminary. And of course, the virus is changing all the time as well. And we're now being told that up to 70% of infections in Israel today might be due to this very infectious British variant. So things are changing all the time.
In your article, Isabel, you mentioned Israel's deal with Pfizer. The company has not signed a similar agreement with any other country. So tell our audience what the agreement consists of and why choose a country like Israel in particular to study as a supplement to some of the clinical trials.
Sure. Well, I think the attraction for Pfizer was that Israel is a small country relatively, population 9 million. It's also a young country, so almost 30% are under the age of 16. So at the moment, we're talking about vaccinating 6.5 million people in an area that's probably somewhere around the size of New Jersey geographically. The country has 4 very, very efficient HMOs. And by law, every Israeli citizen is covered, has to be covered by one of these health funds and be a member of one. And these funds are also highly digitized. So Israel is in a very good position to both vaccinate the population quickly and gather data, which made it a very interesting test case for Pfizer. So when it looked, things were going so fast at the beginning that it looked like Israel might be running out of vaccines by mid-January and have to slow down. And at that point, the Prime Minister, Netanyahu, he reached a new deal with Pfizer, apparently, according to what he announced, according to which Pfizer guaranteed a steady supply of vaccines, in some cases actually bringing deliveries forward ahead of what was contracted. And in return, in exchange, Israel would be providing data. Now, there were, of course, questions. What kind of data? Is this going to compromise people's privacy? The Health Ministry did publish a kind of redacted version of the deal on data sharing. And essentially, we have been assured that there'll be aggregated data handed over, but nothing that would violate Israel's privacy laws protecting individuals. So that's essentially the deal.
There had been some, I guess, disagreement about getting Palestinians vaccinated. Now the Israeli government announced yesterday that it would transfer 5,000 doses of the coronavirus vaccine to Palestinians to immunize frontline medical workers. Initially, the argument from the Israeli government was, it's not their responsibility to source vaccine for Palestinians. What can you tell us about the situation there in terms of the virus, vaccine distribution, whether or not they've come to some sort of agreement moving forward? What's happening?
Well, the Palestinian Authority in the West Bank initially seemed to want to actually go it alone. The Prime Minister spoke about making their own plans, but they were late to do so. And of course, as the West Bank is under Israeli occupation, there was certainly a strong argument to be made, and it was made by human rights groups and then by the authority itself, that as the occupying power, Israel is essentially responsible, is obliged to transfer vaccines to the Palestinians. The Israeli government said, well, under the peace accords of the 90s, which were interim accords that never quite ended with a formal final agreement, the Palestinian Authority is responsible for the health services there, which is also true. But they did say when our first obligation is towards our own citizens in Israel. When we have that under control, if we can, we'll help. So it now appears that the Israelis just today have actually transferred the first 2,000 doses of Moderna supplies that they had, and have another 3,000 which they've approved to transfer in the coming days. And in the meantime, the Palestinian Prime Minister announced today that there would in fact be the beginning of a vaccination program in mid-February. 50,000 vaccines are supposed to arrive from donor nations through the International Organization of Health organizations, and also some of the Russian vaccines that the Palestinians have agreed to use. And towards the end of the month, end of February or possibly early March, there is supposed to be a delivery of 2 million vaccines that the Palestinian Authority has bought from the Oxford AstraZeneca. So yes, it's been a controversy and a debate, and the Palestinian Authority in Israel and Gaza. I mean, the virus obviously doesn't recognize borders. It moves both ways. Tens of thousands of Palestinians come in to work, and you know, for the benefit of both sides, clearly cooperation is the way to go.
Completely agree with you on that one. Isabel Kershner, thank you so much.
Thank you for having me. Thank you. Good day.